Here we go. This is what I want. So if you remember in our study area, the study by chapter, we have the respiratory system. And there's all the links to the e-text and all the things that go along with that. But also here is the interactive physiology. This interactive physiology has some great activities, and one of them involves our pulmonary ventilation. I don't know how well you'll be able to hear this, but I want you to see the beginning, to see this compliance stuff that we're talking about.
In order to understand ventilation, we must first look
Although
at the
this is, they talk
relationship.
about Boyle's
Let's see what
law.
happens when the pressure of a gas, the diaphragm, and the external intercostal, increasing the volume, which acts like a suction. Intrapleural pressure is the pressure within the pleural cavity. Intrapleural pressure is always negative, which acts like a suction to keep the lungs inflated. The negative intrapleural pressure is due to three main factors: the surface tension of alveolar fluid, the elasticity of the lungs, and the elasticity of the thoracic wall. Let's observe the effect of the surface tension.
Can you guys hear that? Okay, perfect.
The surface tension of the alveolar fluid tends to pull each of the alveoli inward, and therefore pulls the entire lung inward. Surfactant reduces this force. Let's see the effect of the lung's elastic tissue. The abundant elastic tissue in the lungs tends to recoil and pull the lung inward. As the lung moves away from the thoracic wall, the cavity becomes slightly larger. The negative pressure this creates acts like a suction to keep the lungs inflated. Let's observe the effect of the thoracic wall's elasticity. The elastic thoracic wall tends to pull away from the lung, further enlarging the pleural cavity and creating this negative pressure. The surface tension of pleural fluid resists the actual separation of the lung and thoracic wall. Watch what happens if you cut through the thoracic wall into the pleural cavity. Air enters the pleural cavity as it moves from high pressure to low pressure. This is called a pneumothorax.
So there you go. There's a lot of really, really great material on here that you should be looking at if you are not doing so already. So make sure you're looking at these things, and especially if some of these concepts aren't making as much sense to you, there are things here that can make it much easier to understand and to follow. All right. So these are the factors that influence and affect how our air is going to move. All right. Pressure changes move the air. And the reason for this is respiratory pressure is always related to atmospheric pressure. When we talk about it, we always refer to and relate to the pressure of the air around us. And we're pretty close to sea level. So what is our pressure of the atmosphere? What is that value? What is the value of atmospheric pressure?
1 atmosphere.
True, it is 1 atmosphere, 1 ATM, which is a useful number for some things, but that isn't necessarily going to be very useful for us. How else can it be? There we go. That's the other one I was looking for, 760 millimeters of mercury. So 1 atmosphere is absolutely correct, but the 760 millimeters of mercury will be a more meaningful number for us. So when we talk about our respiratory pressures, we always relate them to that atmospheric pressure of 760 millimeters of mercury. So our atmospheric pressure, our pressure of the atmosphere, is exerted by the air surrounds us, pushing down on us. And as I mentioned, it is 760 millimeters of mercury, or can be considered 1 atmosphere. A negative respiratory pressure then is a pressure that is less than that. So if it was 759, that would be considered a negative respiratory pressure. And a positive respiratory pressure is a pressure that is greater than atmospheric pressure. And in that greater than atmospheric pressure, it would be a positive number, so 761 and above. This allows us to understand these pressures, and there are three main pressures we need to be aware of. Well, kind of 3.5. The first, as we talked about, is atmospheric pressure. So we already have that atmospheric pressure. Actually, let's do it this way. This might be an easier way to do this. All right. So atmospheric pressure, as we know, is the pressure of the air that surrounds us. And as we mentioned, it is a constant, and that constant at sea level is 760 millimeters of mercury. Next pressure we need to talk about is the intrapulmonary pressure. That intrapulmonary pressure is the pressure inside of the lungs. There are two keys to this intrapulmonary pressure. The first is that obviously it can change. And more specifically, it can be a positive or a negative pressure. That means it can go above atmospheric pressure or it can go below atmospheric pressure. So sometimes it'll be positive, sometimes it will be in negative pressure. Okay? However, regardless of how positive or how negative it gets, it will always equalize to atmospheric pressure. So it can change. It will sometimes be positive or it can be negative, but it will always equalize to atmospheric pressure. All right. Third pressure we need to know is our intrapleural pressure. This pressure is the air pressure inside of the pleural cavity. So basically, this is the space between the visceral and parietal pleura. That lines the lungs. And the parietal pleura that lines the thoracic cavity. This is always, well, first let's say this, like the intrapulmonary pressure, it can change. However, it is always a negative pressure. In fact, as we just saw in the video, if it becomes equal to the intrapulmonary, what happens? What did we see happen on the video? All right, well, the lung collapses. And it cannot be, well, let's just say it collapses. And then you would have to remove that air, get pneumothorax. Excellent. The lung will collapse. Lung collapses as a result of that. So those are the three important pressures. Remember I said 3.5 because obviously the relationship between the intrapulmonary and intrapleural pressure is important. The absolute value isn't so much as important as the fact that there be a difference between the two. And so basically, we relate that or call that the transpulmonary. Transpulmonary pressure is just the difference between the two thoracic cavity. Let's be specific. The difference between the intrapulmonary and intrapleural pressures. And in fact, that is how you would calculate it. The transpulmonary pressure is equal to the intrapulmonary minus the intrapleural.
And for the intrapulmonary pressure, so you said it can go negative, but it only matters if it's still more than the intrapleural pressure?
Yep. In fact, we will actually map these. So I will actually further, hopefully, attempt to make some sense of this.
Okay.
Okay. So this is our starting point. All right, we've written it out. Let's look at the pretty picture that does the exact same thing. So again, our intrapulmonary pressure is the pressure within the lungs, within the alveoli. The intrapleural pressure is the pressure between the lungs and the thoracic wall inside of the pleural cavity. And as we mentioned, the transpulmonary pressure is the difference in between the two. Okay? With me so far? And like I said, this transpulmonary pressure is what keeps the lungs inflated, keeps the airways open, right? As we talked about, if the intrapulmonary and intrapleural pressures became equal, then the lung would collapse. Now notice on that illustration, and let's go back to it because it's a quick cheat. Notice only one of the lungs collapsed when they poked it with the scalpel. Why is that? Why didn't both lungs collapse? What do you guys mean by separated? You're absolutely correct, but be more specific.
Two plurals.
Right. Remember, each lung is surrounded by its own independent pleural cavity. Remember, those pleural cavities are independent and separated, so they have their own pleurals around them. So an injury to just one side doesn't affect the other. All right. Again, I don't know how many of you follow sports, but for the San Diego Chargers earlier this season, their starting quarterback ended up being out at the last minute for a game, and they've got a rookie who stepped in and has now done amazing and isn't going to give up the job anymore because what apparently happened is that he had some cracked ribs. And because he was in a lot of pain because of the cracked ribs, a doctor tried to give him an intramuscular injection to try to help to alleviate some of that pain in his ribs, put the needle in too far, poked the pleural cavity, and ended up causing the lung to collapse. And the quarterback ended up basically losing his starting job because of that now, because of a mistake that a doctor made by penetrating that needle too far and causing the lung to collapse just like this. All right. So let's go here. I would. Excellent. So let's take a look. So if I'm not going to bother redrawing this picture, but I want you to see this and I want you to understand how this works so that we can talk about this over here on the whiteboard. Actually, I lied. I think I am going to draw it just because it amuses me to do so. All right. So let's cheat. Put a box over here. That is our thoracic cavity. And of course, inside of that thoracic cavity is our alveolus, which is the lung. And that, of course, is connected to a tube. Put that there. Oops, I'm off the screen. Bring this down. Bring this You get down. Bring that down. Bring that down. Bring that up. And now to completely cheat, we will do that. We will do this. And we will do that. Excellent. There's the airway. Perfect. All right. So again, this is our pressure inside the lungs. This is our pressure inside the pleura. And of course, this all relates out here to atmospheric pressure, which, as we said, is 760 millimeters of mercury. All right. That is our starting point. So if you think about it, great question. So if you think about if the intrapleural and intrapulmonary pressures are equal, then what happens, our transpulmonary pressure becomes 0. And if our transpulmonary pressure becomes 0, that's when the lung collapses. There needs to be a positive number. That transpulmonary pressure needs to be a positive number. The pressure inside of the lungs has to be greater than the pressure inside the pleural cavity. If they become equal to each other, then the lung collapses. All right. Got it. Excellent. Thank you for asking that question. All right. So here's our picture. And now what I'm going to do over here is draw a graph. Now, graphs are always a little bit tricky because obviously this is something you can't easily draw on an exam. Technically, we have the whiteboard, but I'm not likely to ask you to draw these things. Normally, you would be drawing this on an exam, but we won't worry about doing that for this. But I think the visual of it does help us to understand this. So we'll put that there. And then what I need is a thin line like that. This, of course, is going to be our atmospheric pressure, 760. Numbers up here would be positive pressures because they are less than, pardon me, more than 760. And numbers down here would be negative pressures, less than 760. All right. Now, we know atmospheric pressure is always going to be at 760. We also know that no matter what happens to our intrapulmonary pressure, remember, it's always going to eventually equal 760. So let's go ahead and put a nice big red dot right here to represent our starting point of 760 millimeters of mercury. And we'll put that red dot here to remind us that that's what that red dot represents. Conversely, we will make a blue dot to represent our intrapleural pressure. And our intrapleural pressure, remind me again, should it be equal to, greater than, or less than our intrapulmonary pressure?
Less than.
Less than. And so we'll put it down here. And we'll give a value to that. At a normal resting point, 756. A 4 millimeter of mercury change. Okay? So this is our starting point. Questions on this? All right, let's talk. And again, what we are going to talk about here is the pressure changes that occur from a complete respiratory cycle. One inhalation, one exhalation. Okay? So, you start that first inhalation we increase the volume. So let's start here and let's write small so that it fits. So we are going to talk first about our inhalation. For this inhalation, if we want to inhale, the first thing we have to do is we contract the diaphragm, we contract the other muscles, and as we know, that is going to increase the volume of the thoracic cavity. And as we increase the volume of the thoracic cavity, right, the thoracic walls are going to go out. Too small. I don't like blue. So our thoracic walls expand. And again, because of the surface tension, because of the pressure here, our lungs expand as well. So when volume goes up, what happens to pressure?
Goes down.
Excellent. So what's going to happen is our intrapulmonary pressure decreases. And so if we were to be drawing this, this pressure would go, that's too small, let's go a little bigger, is going to go down. Now, notice what's happening here. Our thoracic cavity is expanding. As it expands out, our pleural cavity gets bigger as well. So as our thoracic cavity gets bigger, our pleural cavity gets bigger. And as it gets bigger, what happens to the pressure inside of our intrapleural cavity?
Also increases.
Well, if the volume gets bigger, what happens to the pressure?
Goes down.
Pressure goes down. Put that there. Grab my line, make it blue. And the pressure goes down. So notice both pressures are going down. And as it continues to expand, they're going to continue to go down. All right, let's go ahead and cheat and draw a thin highlighted line here as our midpoint for our inhalation. Now, notice here that with our intrapleural cavity is open to the outside world, right? Through our respiratory tract. And since our intrapulmonary, hopefully your intrapleural cavity isn't. Since your intrapulmonary cavity, your lungs, are open to the outside world, when this pressure drops, you now have a lower pressure inside of the lungs than the pressure to the outside world. And so what's going to happen in that case?
Air comes into the lungs.
Air enters into the lungs. Now, remember, the pressure inside of the classroom is based on the number of times that you guys bump into the walls. However, I made the room bigger, and so you bumped into the wall less, and the pressure went down. But then I opened the door, and because I opened the door, 15 more students can enter into the classroom. As more air enters into the lungs, what happens to the number of times the gases are going to bounce against the wall?
Increases.
It's going to increase. And so what's going to happen is as the air increases, we have more air in the lungs. So as a result of that, pressure goes up. And it is going to continue to increase until what happens?
Equilibrium.
Excellent, until it reaches equilibrium with the atmosphere. And so what's going to happen to our pressure of the lungs, that line again, is it is going to go back up. So notice first it went down and then it went back up until they're equal. And if you think about it, this is a fancy looking curve and it may be getting pretty confusing, but this is information you already know. Can you inhale forever?
No.
No. And eventually you reach a stopping point. You make your thoracic cavity as big as you can. And as you make it big, that drops the pressure and air starts to come in. But as air starts to come in, more and more air in your lungs brings the pressure back up until the pressure becomes equal with atmospheric pressure again. At that time, air stops going in. So no matter how big of an inhalation I make, eventually I have to stop. So great question. Is it possible to train your lungs to be able to fill with more air? Limited. We have a limited ability because, again, it's limited not so much by training, but by the mechanics of your thoracic cavity. How much training can you do to make your ribs bigger? Not a whole heck of a lot, right? Maybe some muscle control can allow that. There are a few minor things we can do to try to improve how much air we're able to get in, but we're stuck with a pretty strict physical limitation on how big we can fill our thoracic cavity, how big we can fill our air. Okay, so notice this pressure goes back up to equal to atmospheric again. But what about our intrapleural cavity? Is our intrapleural cavity open to the outside world? Is closed to the outside world. So is there going to be any air that enters into this one?
No.
No. So outside world, no air enters, and the pressure stays low. So as a result of this, that pressure continues to go down as we close the thoracic cavity until it reaches whatever that low point is. All right. So that is our inhalation. Questions on that? All right, excellent. So now we have to exhale. For our exhalation, it starts with letting our, again, a normal resting breath, with a normal resting breath. It is mostly just relaxing the muscles. They go back to original shape. It's a passive process. But as they go back to the shape, the elasticity of the thoracic cavity and the lungs recoil and get smaller. And as they get smaller, what happens to the pressure? As our thoracic cavity gets smaller in volume, what happens to the pressure?
Decreases.
As a result of that, our pressure increases. And as a result of that, our pressure goes up and becomes positive. Now, if our thoracic cavity is recoiling and going back to its normal shape, what happens to the volume? What happens to the volume of the pleural cavity?
Also decreases.
And as it decreases in volume, what effect does that have on the pressure of the intrapulmonary cavity? Pressure increases. So as a result of this, our pressure starts to come back up as a result. Now, as the pressure increases, remember, we are open to the outside world. And since this is open to the outside world, is that air going to want to stay in the lungs where it's low pressure? I mean, where it's high pressure?
No, it follows its gradient.
Yeah, exactly. It wants to move away from the higher pressure. So what happens is our air moves out of the lungs. And as our air moves out of the lungs, we have less air in the lungs. And as we have less air in the lungs, what happens to the pressure?
Goes up.
Is it going up at this point? If I start moving people out of the classroom, what happens to the number of times people bump into the walls?
Decrease.
It decreases, absolutely. Pressure decreases, and it's going to continue to decrease until what happens?
Can't exhale anymore.
And why can't we exhale anymore? Why won't the air move out of our lungs anymore?
There's no outside pressure on the lungs.
Well, you got the right idea. There's no pressure gradient. So what would the pressure inside the lungs be? Remember, go ahead.
Lower?
Lower than what it is, but remember, so air is moving out of the lungs because the pressure in the lungs is greater than the pressure outside. So as long as the pressure in the lungs is greater than the pressure outside, air is going to go to the lower pressure. And as air leaves, the pressure goes down until what happens?
Another equilibrium?
Yeah, we reach equilibrium again. It's going to continue to decrease until it is equal to the atmosphere again. And so what's going to happen is we are going to get a drop in pressure until it reaches 0 again, which is where it started. Now, once again, no air leaves the intrapleural cavity. So as a result, pressure just continues to increase. Back to 756.
Intrapleural cavity air? It's not air there, right?
Well, it is a space that it's not a complete vacuum, right? So it is a space, but and so there is, but the point is that there's nothing is coming in or out of it. So it goes back to our starting point. So notice we've now gone a complete respiratory cycle, an inhalation and an exhalation. and we've seen how those pressures change.
Can this
And
be
again,
affected by like your skeletal muscles and your lung capacity? So like if you don't have as much lung capacity, could you not reach a certain pressure in your lungs?
so you've got the right idea. In a normal, typical, healthy adult, the numbers we are talking about here, for instance, these changes in our intrapleural pressure in a normal resting breath, while you're just sitting there taking a normal resting breath, we're talking about a +2 increase, and we're talking about a -2 increase. So we're talking about small movements of air that are occurring here. So small pressure changes, small movements of air. However, that's not your maximum, right? While you're sitting here resting, why, if you really want to, you can get a lot more. And obviously to get a lot more, you have to change those pressures more. Now, is every single person in this class able to move the exact same amount of air into and out of their lungs? No, of course not. And exactly for the reasons you've talked about. The flexibility of your lungs, the flexibility of your ribs, the size of your thoracic cavity. All of these things are factors that can have an effect on it. And if you also think about it, it changes over time, right? When we're very young, our volumes, our size of our lungs are very small. So when we take one breath, very little air comes in. So when we're young, we typically have a very fast respiratory rate. As our bodies get bigger and we have more volume, respiration rate goes down. But then as we start to age, right? Grandpa's had those rib injuries from when he was working in the coal mine, right? He has that decreased elasticity because he's taken 10 million breaths in his lifetime. And so now as he has less movement of his thoracic cavity, he gets less air into his lungs with each breath. So as we tend to get older, as we tend to get more elderly, our respiration rates start to increase again, because we become less efficient at breathing. So yes, it's different from person to person, but it's also going to be different throughout the course of our life as well.
What about segments? Oh, I'm sorry.
Oh no, I was just saying thank you.
Yep. So what were we saying, Oksana?
What about the segments availability? If some removed is also like...
Yeah, so yeah, if Grandpa did indeed work in a coal mine, then not only is he not able to, lift his lungs as much, to inflate his lungs as much to get in, but also some of his lungs are going to be damaged. Or maybe he didn't work in a coal mine. Maybe he was like my grandpa, who smoked 2 packs of cigarettes every day, right? Is he done some serious damage to some of those alveoli, reducing the amount of space he has to put air into? Right? If you've damaged half your lungs, does it really matter how big you can make your thoracic cavity? You're still not going to be able to get all the air you're normally going to get in from a single breath. So your respiration rates would go up as a result of that. And his volumes would go down as a result of that lack of space in there as well. Absolutely. Again, I may not have done as great of a job of drawing this, but again, your books got great pictures that show this. So notice, let's go through this and talk about it. As we talk about, the pressure inside of our lung is always fluctuating. It's always, sometimes it's positive, sometimes it's negative, but remember, it always equalizes to atmospheric pressure. And our intrapleural pressure has always got to be less than both. All right? Here is that graph that I was trying to draw for you. Notice it shows the changes in pressure and the amount of air we're moving into our lungs. So just like we talked about, if we follow, and let's just do one pressure at a time. In a complete respiratory cycle, one inhalation, one exhalation. What's happening with our intrapulmonary pressure is that we increase the size of the thoracic cavity and volume goes up, and as volume goes up, pressure goes down. But because this is open to the outside world, we have produced a pressure gradient, and so air is going to rush in until air is happy. And where is air happy? At equilibrium. notice in that time, we have inhaled about a ½ liter of air. Then we relax those muscles. The volume of our thoracic cavity goes down and the pressure goes up. Again, we've set up a pressure gradient, and so air is going to want to move down that pressure gradient out of the lungs. As it leaves the lungs, the pressure of the lungs drop until it equals the atmosphere again. And we have breathed out that ½ liter of air that we brought in. Brought in a ½ liter of air, breathed out a ½ liter of air. At the same time, the pressure in the pleural cavity changes as well. The difference here is that air can't move into or out of this space. So when the volume of the thoracic cavity increases, the pressure in it drops, and it stays dropped. When the thoracic cavity recoils and gets smaller, the volume goes down, the pressure goes up and stays up. All right, we get a much more complicated change and effect on our intrapulmonary pressure because it's open to the outside world and air moves in and out. Questions on this? So here we see Boyle's law and how Boyle's law helps us to move the air into and out of our lungs. We change the volume, we change the pressure, and when we change those pressures, air is going to move. All right, stunned silences. I love that. Excellent. That means that everybody understands it, mastered the information, and I may make the questions on it as hard as possible. Love that.
I want to ask.
Oh, sure. Go ahead.
Okay. For example, if not all segments working, like some of them collapse or something, so the volume is lesser, but the pressure is going to be, the numbers of the pressure going to be the same anyway, right? It's the same as I inhale, and it's the air.
No. So remember, the reason this, so I understand what you're saying, but remember, the reason that this pressure is dropping is because the lungs are expanding. And so inside the lungs, you have more volume. And if you have more volume, you have less pressure. If half of the lungs is missing or damaged or closed, then when that lung stretches, the volume isn't going to increase as much. So you would have a smaller increase in volume. So you would have a smaller increase in pressure. And because you had a smaller increase in pressure, you would get less air into your lungs.
So I will never reach equilibrium?
No, you're still going to reach equilibrium. What would happen instead, so let's take this chart right here. This is perfect. If we took this chart right here and instead we did a grandpa who has that pulmonary issue as a result of working in that coal mine, then what's going to happen is that he's going to get a smaller or more shallow curve.
Yeah, okay.
It's still got to come back to equilibrium. Grandpa still can't breathe in forever, but he can't open his lungs as much. So without being able to open his lungs as much, the volume change is smaller. So the pressure change is smaller. So less air comes inside. But it's still going to reach equilibrium. His is just going to be more shallow than yours is.
That was my question. Yeah, thank you. Makes sense.
Yep. Great question. Any others? All right, perfect. This is a good stopping point then. Looks like it's 1:10, so we will restart at 1:25, and I will restart the recording at that point. All right, any questions? Last call. All right, see you guys in 15 minutes.